Hi there, my name is Mina Alvarado. I'm taking medical physiology at the University of New England. In this video, I will be providing an overview to a digestive system case study. Today is Wednesday, July 27th. Here is a sheet that has my name and the date, and that I'm taking this course. Now I will go over the case study. So here is our case study and the question of interest. This case follows a patient with a gallstone. She initially presents with jaundice, but the nurse uses reasoning about the function of bile to inform her assessment questions and discovers that the patient also has fatty stools. The doctor, using knowledge of the biliary tract's anatomy, orders tests of liver and pancreatic enzymes and an X-ray, which confirms the position of a gallstone blocking the ampulla of Vater. That night, the patient suffers an attack of acute hemorrhagic pancreatitis, which the nurse discovers when she presents with pain and signs of sympathetic system activation. And the question is, how will fat digestion in this patient be affected? Here in the corner, we have an image of some of the organs that are involved. And here I've attached a link to a digestive system worksheet that I've created, looking at the structure and the function of the organs that are involved in this case. And we'll look at that. Here is a diagram of some of these structures that are involved in this system. I drew it. First, you are to label them with their name. And then next, you are to match the anatomical structure to its role in digestion. Here are the structures. And then these answers may be used more than once. So this is to practice talking about these structures and what they do. So then we can take that knowledge and then implement it into looking at this case. So normally, the liver, the pancreas, and the intestine produce secretions that aid in digestion. Some of these secretions include digestive enzymes, bile, mucus, and isotonic sodium chloride solution. But here we're going to talk about bile. Bile is a non-enzymatic solution that is produced in the liver, and then it is stored in the gallbladder. It consists of bile salts, as well as cholesterol and the pigment bilirubin. Bile is used to aid in the digestion and absorption of fat. It's sent to the gallbladder, as we mentioned, and fats are particularly complicated and difficult to digest because they're lipids, and so they're not soluble to water. Then bile works to emulsify them and makes them easier to digest. So when the gallbladder is contracted, it propels bile into the duodenum and through the common bile duct. I think here we have a little diagram, and then this would be the common bile duct. Bile salts are then reabsorbed in the ileum of the small intestine and also the colon, and then they are returned to the liver. And this recycling of bile salts is necessary to the digestion of fat because they make fat soluble by acting as detergents. Here's a diagram that describes the path of bilirubin. Bilirubin that's found in bile is a waste product of the hemoglobin degradation, and it can't be reabsorbed. So we have red blood cells. They contain the protein hemoglobin. When they become old or dysfunctional, the spleen converts heme from hemoglobin into bilirubin, and then from there, bilirubin is converted into bile by the liver. In the case of our patient who is experiencing jaundice, we will see a yellowing tint of the skin and the sclera of the eyes, which indicates that there is a buildup of bilirubin that's in the blood. This allows us to infer that there is an underlying problem of some sort of difficulty converting the bilirubin into bile. This explains why the patient was experiencing fatty stools, because it means that they had an inability to digest fat. And here we have some images that show what jaundice looks like. There's a yellowing of the skin, and you can see it very clearly in the eyes that they look yellow. Then from here, we can surmise that specifically this patient is experiencing a problem with the hepatobiliary system, which involved the liver and the gallbladder structures. The conformation of the gallstone in front of the ampulla vater that was blocking the pancreas explains why the patient was suffering from pancreatitis. The pancreas is inflamed due to being blocked, which indicates the reason for the patient's pain during the pancreatitis attack. This makes sense why the sympathetic system is being activated in order to allow the body to enter the fight stage from the fight, flight, or fright response in order to combat the symptoms from the pancreatitis attack and to return the body to homeostatic levels of function. With an obstructed bile duct, the gallbladder is unable to store bile, so instead it is sent to the duodenum to digest fat. So there is my overview of this case study. I hope you found it informational. Thank you for watching.